Hello, my name is Surili Sutaria Patel. I'm the director of the Center for Climate, Health, and Equity at the American Public Health Association. Never before have we seen co-occurring crises wound the country and the world while simultaneously unearthing deeply rooted social and racial injustices. The short and long-term health implications of climate change, COVID-19, and the movement for Black lives beg the need for action that addresses all aspects of harm brought upon us today. Not acting on climate and health in a unified and holistic way is not an option anymore. And that's why I'm looking forward to sharing with you the things that we're working on to address climate change and health and possible steps you can take in your association to reduce the harmful effects of climate change to build a healthier future with us. The American Public Health Association champions the health of all people and all communities. We strengthen public health profession, we promote best practices and share the latest public health research and information. We are also the only organization that combines nearly 150 years of perspective, a broad-based member community, and the ability to influence policy to improve the public's health. Our mission is to improve the health of people, of the public, and achieve equity in health status. That includes addressing the health challenges in the face of a changing climate. APHA's journey in climate change dates back to 1923, when we published an article that said in about 100 years, the health impacts of climate change will be felt if we don't do something about it. Well, we're there, and boy, are we feeling those health impacts today. APHA, along with the public health practitioners, academics, students, nurses, and so many more that make up the workforce of public health, are trying to understand climate change and health and build some compassion and partnerships outside of the health sector to better understand the intersectionality of health and climate. The Center for Climate, Health, and Equity is just 2 years old, but APHA has been in the climate and health space for over a decade to elevate this issue, but now it's time to act. We have learned that there is a need for more training of the public health workforce. We need to learn the connection, talk about how to take action, and use the tools and resources that we have at our disposal, all while bringing along partners from outside of the field of public health to augment these activities. We need to build cohesion around the movement by offering strong and clear messages about how climate change harms health and using these messages to inform policy. And we need to build capacity to increase the need to address the local issues and pair them with state and national legislation that allows the programs and practices at the local level be accessible and as affordable as possible. Today, we lead public health efforts to inspire action on climate and health with the concepts of health equity, environmental racism, climate justice at the center of our policies, recommendations, and strategies. So why is climate and health an important topic of today? Let's see. Climate change exacerbates health inequities, disproportionately harming the most climate sensitive among us. That includes children, pregnant people, people with low wealth, and the aged, and people with disabilities or chronic illnesses, in some communities of color, Indigenous people, tribal communities, immigrants, migrants, and so many more. What I've understood in my practice is that in order to achieve good health, the doctor's office and a prescription can only help us there 20% of the way. The other 80% of what it takes for us to achieve good health comes from the structural and social determinants of our health. That means access to a good job, access to education, access to clean and safe and affordable water, and so much more that contributes to a holistic being of health. And climate change, in the most basic way, affects our ability to achieve those social and structural determinants of health. So here are a few tips that associations like yours can do to help with this complex issue. Let's make climate healthy choices easy and accessible choices by offering employees access to community gardens or locally sourced foods in the cafeterias. Maybe incentivize walking, biking, or rolling to work, or even taking public transportation. Next, let's raise awareness of how climate change can impact the health of your staff and the community so that they can take action to protect themselves and their health. Let's do this by coming together to discuss ways to reduce energy inefficiencies in the offices. Let's purchase clean energy from our utility companies or divest in an organization-wide from fossil fuels. Let's offer mental wellness services to those who may be coping from a recent climate event or experience eco-anxiety. It's also important to create spaces to discuss local climate issues and solutions and create more options for remote or low carbon footprint convenings. And if you are in the business of convening large meetings or conferences, here are some tips for you. Select a location that minimizes the distance people have to travel. Look for locations where facilities around it, like restaurants or airports, are within walking distance or accessible to each other by mass transit. Provide the registration and event materials online to reduce the use of paper. And if possible, try to recycle or donate unused materials and choose reusables whenever possible. And lastly, work with many local suppliers, including locally sourced food and beverage, since local food tends to have a smaller carbon footprint. In public health, we often talk about the climate and health crisis through the lens of action, and we recognize that we are the first generation to possibly feel the health impacts of climate change, and certainly one of the last to do something about it. So please join us in being part of the solution.